Do you have a bunion and think you need surgery? Make sure you watch this video. I'm going to talk you through the top three things that we do find when people have bunion surgery and the downsides of bunion surgery. And it's not to say bunion surgeons don't do a great job. It's just that people seem to think that there's no other option other than bunion surgery. So I'm going to talk you through some of the negative aspects of bunion surgery, some alternatives that you might like to look at so you can avoid the need for bunion surgery, and a great special offer that we can help you avoid the need for bunion surgery if you wish. My name's Daniel Fitzpatrick from Sydney Foot Solutions and also Sydney Bunion Clinic. We do stacks of work with bunions. We see heaps and heaps of bunions. In fact, well over 100 a week. We have a lot of motivated people who come to see us because they want to avoid the bunion surgery. In the background, we can see a couple of bunion surgeries, and it's not that they're badly done. You can probably notice that there's a fair bit of hardware in there because what they're actually doing is that they go in and they recorrect and break these areas. This particular person had a couple of whopping big bunions, apparently, and they've come to see us because they're getting secondary problems. And what people don't understand with bunion surgery is that it is a really big deal. And a lot of people are quite flippant about the whole surgery thing. And if that suits you, then absolutely go for it. And if you had a good result, great. I wish you the best. I know that when I do these videos, I get hammered by people who it could result with bunion surgery. That's not to say you won't get a good result with bunion surgery, but keep in mind, even surgeons will say that bunion surgery is trauma to your foot and they have to cut open and break a whole range of bones within your foot. And this is a prime example of that. How you can see all the pins in here. And keep in mind, you've got to go and walk on these feet after you had the bunion surgery done. So needless to say, we get a lot of motivated people come to see us who are very motivated to avoid the need for bunion surgery. The great thing is that 9 times out of 10, you can avoid the need for bunion surgery if it's treated conservatively early enough. In fact, we do it all the time. We get loads of successful bunion people come through and do our bunion treatment and treat it very successfully. But one of the big downsides if you do have bunion surgery, and something to be aware of if you had the bunion surgery, and we can treat this effectively also, is that what often happens is you start to get pain around this aspect of your foot. You become very prone to neuromas and metatarsalgia through this area because you're putting more weight down through your foot. And the downside of that is it can be cripplingly painful. There's no pain like nerve pain. And this particular individual has started to get a partial subluxation through this area here, where the bone has come out of alignment, and now the joint is incredibly flared up. So they've come to see us. We are doing laser therapy on this person, and it's working really, really well. Thankfully to say, it's helping her pain levels a great deal. But the reality is that if we're being honest, in most cases like this, we can avoid the need for this surgical operation to begin with. So, and the great thing is we do that effectively all the time. And probably the things to be really aware of, if you do have a bunion, then I would treat it sooner rather than later, even if you don't get pain. Because often people will say, oh, I have a bunion, but it doesn't hurt me. And I'm sure there's some of you watching this video who very much feel that way. The reality is, though, is that statistically, we know that eventually it probably will hurt you. And the problem with that mentality is that if you leave it long enough, your only option is going to be surgery. So if you want to avoid surgery, then I would try and get on top of it as soon as you possibly can. It's for this reason we do our 60% off initial bunion assessment. We do stacks of bunion assessments, and we try and make it reasonably cost effective so people can come in and get their bunion checked out by someone who is an expert in that area. So just keep that in mind. If you want to go ahead with that, click on the link below. We do stacks and stacks of or bunion treatments, and it usually is very effective in over 90% of cases. So the other thing to be aware of is try not to wear any shoes that are aggressively too tight. So you can still wear high heels. That's not why you're getting a bunion, in my opinion. But the thing to be aware of is try not to wear any shoes that are too tight or putting too much force through there, because they will accelerate the degenerative change through your big toe and cause the problems. And the other thing is that you want to try to address the underlying cause of why you get your bunion in the first place. And so if you can't come and see us, whoever you go and see, I'm sure we'll be aware of this, but please be aware that the reason you get a bunion is because of the way you stand and the way you walk. And so you want to correct that as much as you possibly can so you can stay on top of it and avoid the need for bunion surgery. The downside is they don't do anything about this part of your foot, which is the way you stand, the way you walk, which definitely affects that. And so please be aware of that. And we find that that's one of the huge strengths in that giving someone a more functional foot is you start to address that underlying cause of why someone's got a bunion, and you can really help that functionally long term. I hope this was helpful. If you'd like more information or to find out more, maybe check out our special offer. Also go to sydneyfootsolutions.com.au and check out that 60% off initial assessment offer.